Hey, Dr. Peter Skridillis here with Dr. Bill McGill for Skridillis Chiropractic. Today we're going to go over some really good upper core neck stabilization exercises that are great both in the acute phase initially when you're injured, when you have some pain, but also great later on to really get you to work those deep cervical muscles which we don't work regularly. First thing you need is you need a really good band. We like the CLX bands, they're great, they have loops built in. If you don't have a CLX band, you're going to have to wrap the band around your hands because we don't want you gripping anything. When you grip things, you tend to tighten your neck muscles up, so we want everything nice and relaxed when we're doing these exercises. So with our hands through a loop, we're going to now skip a loop in the middle here because that loop is going to go around the back of your head. So Dr. Bill's going to take it, put it right behind the back of his head. Now he wants to keep himself in a nice neutral position. That means his ears over his shoulders. If you're really having a hard time finding where that position is, best thing you can do is stand yourself up against the wall. So if you walk yourself back to the wall, your shoulders should touch the wall and your head should touch the wall while your chin is parallel to the floor, nice and even, okay? From this position, what he's going to do now is pull the band forward. His head stays where it is. So he's going to start pulling, and then he's going to hold at the end, 1, 2, 3, and then slowly return, feeling the deep neck cervical muscles working. Again, and back in. Now once he has a good indication of where neutral is, I want him to walk away from the wall, and now try to really feel where that position of neutral is and do the same movement, and trying to keep the head back, not letting the band pull the head forward, and then coming back in. And that's our retraction exercise. For our rotation exercise, we're actually going to start in the same place. We're going to bring the band behind the back of our head, but now what we're going to do is we're going to cross the band in front of our forehead. Great, just like that. Perfect. And now you can see he just looped that band around his hands. You can do that, or you can put your hands in loops. Either one works. From here, what we're going to do is we're going to do one hand at a time. We're going to apply a rotation force against the head. So go ahead and pull one hand out. And his head is going to want to turn to the left with that band. He's resisting it, and he's going to feel that again against the resistance there. Again, slowly return. Other side. Again, resisting, pulling that nose away from the center of your body, and then slowly return, feeling that resistance. Again, one more time on the left. Perfect. And one more time on the right. Again, resisting that urge to want to move your head with the band. Great. The last part of this is the lateral bending, the lateral movement we're going to do. So for this, we're going to take our band and we're going to put it on the side of our head. Great. You're going to put your hand in through those loops once you get it to the side of your head. Just like that. Again, the hardest part sometimes is getting in the loops. If you're a female and you have some hair, sometimes you have to put a towel or something between the bands so this way it doesn't slide, or just lift your hair up, put it up under your hair, this way you're not going to get any slipping. So from this position right now, he's going to keep his head in neutral, centered with his body. Great. Now he's going to apply some force, and his head's going to want to move that way. We're trying to resist that. And he's going to slowly return. Again, a 3-second hold at the end is enough. Go to the side, hold, and then slowly return. Again, if you're feeling any pain with this exercise, please don't perform it until you talk to your doctor or your healthcare provider. We're doing this in the initial phase, and in most cases, patients can do this pain-free, and it actually helps to relieve their pain. We usually recommend 15 reps of each one, 1 to 3 sets per day, again, building up slowly to those 3 sets.